Okay, so we're going to finish up Module 5 now, and what we're going to do is discuss to sort of compare and contrast two very different types of cancer. So pancreatic cancer and colon cancer. Okay. If you recall this data set that I showed you before, way back in our first lecture, what it's showing you is trends in 5-year relative cancer survival rates compared between different types of cancer. And you can also glean from this data, how things have improved since the 1970s and the survival rates you see in the 2000s. So you can see just for all cancer sort of averaged together, used to be about a 50% 5-year survival rate, and now it's about 70%. And what we can really owe this kind of progress to are two main things. One is much better early detection methods. So the earlier you can find and detect and then treat cancer, the better your survival rates are. So if you can remove cancer before it's spread from its original site, you have really high success rate and you'll have lower chance of that cancer coming back and causing more severe health complications. The other thing is that over these past 30 years, we've really come a long way with much better and much more effective treatment options. And these are ones that we talked about in the last lecture. So what we're going to do now is discuss two very different types of cancer. The first being colon and rectal cancer. And so you can see here that both cancers have about a 65 or 68% 5-year cancer survival rate. And then we're going to compare this when we look at pancreatic cancer, which you can see is only about a 6% 5-year cancer survival rate. And so hopefully at the end of these two following lectures, you'll be able to have an understanding why are the survival rates so different and what contributes to that and sort of where do we go from here? How could you try to increase both survival rates? So how could you impact either early detection or treatment for both of these types of cancers so that you can have a bigger public health impact. Okay. So we'll start first with colon cancer, and the learning outcomes for this module is that by the end you should be able to list the major signs and symptoms of colon cancer, as well as be able to understand and identify the different clinical stages of colon cancer, and then be able to discuss what are the different approaches to screening to detect colon cancer. So colon cancer, this is what your book defines as being a common and yet preventable cancer. Okay, so colon or colorectal cancer arises in the large intestine. So you can see on this diagram here, and hopefully you remember from your anatomy and physiology courses, that the colon and the rectum, they comprise the large intestine. So the first 6 feet of the large intestine is going to be your colon or the large bowel, and then that ends with the last 6 inches being the rectum. Okay, and so any cancer that arises in this portion of the intestine is going to be called colorectal cancer. And most cancers begin in the colon as benign polyps. So you can see in the images here, they're going to be these sort of tissue protuberances that arise in the colon mucosal. And slowly over time, this is what's going to develop into cancer. And this, sort of original benign polyps can become cancerous. They can grow through the colon and ultimately cause disease in other parts of the body. And we'll get to that later in this lecture. Okay. So how prevalent is colon cancer? So overall, colon cancer is the second most common cancer among both men and women in the U.S. And if you look at the estimates for 2014, there's going to be about 96,000 new cases of colon cancer and about 40,000 new cases of rectal cancer. So it's a pretty large, it represents a pretty large portion of the amount of total cancer cases that you see each year. Okay. It's also the third leading cause of cancer-related deaths in the U.S. And then when you combine both men and women together, it's the second leading cause. And the reason for this discrepancy is because prostate cancer contributes to more deaths in men, whereas breast cancer contributes to more deaths in women. But if you look at them combined, it's the second leading cause of cancer-related deaths. So the second most common and also results in the second leading cause of cancer-related deaths. Okay. And that is expected to be about 50,000 deaths during 2014. So if you look at this overall, the lifetime risk for anyone of developing colon cancer is about 1 in 20 or 5%. And the risk is slightly lower in women than it is in men. Okay. So what causes colon cancer? And there really isn't any single cause. There's different lifestyle risks or different health risks that can put you at an increased risk for developing colon cancer, but there really is no single reason why people come down or develop colon cancer in their lifetime. Okay. Like I said before, I pointed out nearly all colon cancers begin as these benign polyps, and they really take a long time before they can develop into any sort of malignant cancer that can spread beyond the colon or rectum. It's about 10 to 15 years, and this is important because 10 to 15 years, it really comes into play when you think about how frequently should we be screening for colon cancer, when should we start screening. Okay, and we'll go over some of the different lifestyle and health-related factors that can increase an individual's chances of developing colon cancer. One thing to point out is that there's certain genetic syndromes that significantly increase the risk of developing colon cancer, and I'll highlight those. Okay, so what are some of the lifestyle-related risk factors that can contribute to developing colon cancer? So it's been shown that diets high in red meat or processed meats, they seem to be linked to an increased risk of developing this type of cancer. Whereas diets high in whole grains, fruits, and vegetables are associated with a decreased risk. And I think that this makes a lot of sense because if you think about your large intestine, all the food that you eat is going to pass through it at some point. And so what's present in those foods and the types of foods that you choose to eat, it could have a direct impact on the type, on how it interacts with that mucosal lining of the colon. And so a lot of work's been going on now to see why exactly is it that certain diets are going to promote your risk of developing colon cancer, and why do some sort of decrease your risk. But consistently, studies seem to find that the increased intake of red meats and processed meats contribute to a higher increase in developing colorectal cancer, where these more plant-based whole grain diets seem to decrease your risk. Okay. And there's also a number of other lifestyle-related factors that contribute to this, and I think a lot of them are sort of the ones you hear all the time, sort of that would increase your risk of any type of cancer. So smoking, even though it will increase your risk of developing lung cancer, it also has been shown that long-term smokers have much higher rates of colorectal cancer, as well as, again, physical inactivity, which we talked about previously. And this is going to be linked to obesity. So being physically inactive, being over that sort of target healthy weight, these are going to put you at increased risk of developing all cancers, as well as especially colorectal cancer. And heavy alcohol intake in particular has been shown to be linked to an increased risk of developing colorectal cancer. Other important risk factors are going to include age. So about 9 out of every 10 people diagnosed with colorectal cancer are over the age of 50. And I think this makes a lot of sense when you consider how does colorectal cancer develop. And so it goes from these benign polyps that take about 10 to 15 years to actually develop into malignant cancer. And so this is important to keep in mind when you think about how should we be recommending people be screened for colorectal cancer, when should we be raising awareness, what's your sort of target audience as a public health professional. And so kind of targeting that over 50-year population, I'm saying, okay, now is the time that you want to approach your doctor, talk with them. Do I have other risk factors? Should I be screened for colorectal cancer? You know, how do I sort of approach making sure that I can detect this type of cancer early? So again, it's mostly going to be individuals who are over 50 that have this type of cancer. Okay. Other chronic conditions can put you at higher risk of developing colorectal cancer, one being type 2 diabetes, and another important one is going to be either type of inflammatory bowel disease. So this includes both Crohn's disease or ulcerative colitis. And I think this makes sense, and it kind of, you should recall from our previous lectures that when you have this chronic inflammation, it's going to put you at higher risk of developing cancer. So if you have bowel disease, if you already have a lot of inflammation and a lot of damage going on in your large intestine, it's going to put you at a much higher risk of developing cancer in that organ. And so individuals with these diseases are usually going to be screened much more frequently, as well as much earlier, because they are known to be at such a higher risk. Okay. And particular genetic backgrounds are going to put people at a much higher rate, a much higher risk of developing colorectal cancer. And we'll talk about two types in particular. So the first main type of inherited colon cancer is going to be hereditary non-polyposis colorectal cancer. This is also known as Lynch syndrome. And it actually contributes to a large amount of the total cases of colorectal cancer that are seen. So about 5 to 10% of all cases are actually individuals that have this hereditary form of colon cancer. And so if you inherit the particular genes that are associated with this disease, it puts you at a risk of developing colon cancer to about 70 or 90% chance that in your lifetime you will develop colon cancer. And the reason for this is that the genes mutated in individuals with Lynch syndrome are components of DNA mismatch repair machinery. And so this makes a lot of sense that if you have, if the protein components of DNA mismatch repair, so these are going to be the particular proteins that are responsible for recognizing when mistakes have been made in the DNA. So if there's DNA damage, if you are growing and dividing as a cell and you make an error while doing that, they're going to help make sure that you catch those mistakes and correct them before they can cause problems like abnormal cell growth that leads to cancer development. And so in individuals with Lynch syndrome, this whole DNA mismatch repair system is not working well. And so you can see right there that they're going to be at much higher risk of developing any sort of mutations that can cause abnormal cell growth. Okay, and so you would think too that individuals with Lynch syndrome are also going to be at higher risk of developing other types of cancer. But the one that you see most commonly is going to be colorectal cancer. And so once an individual has been identified as having some of these mutations or has a family history of Lynch syndrome or a suspected family history, they'll be much more likely to be screened at an earlier age and often be screened more frequently. The other type of inherited colon cancer is going to be familial adenomatous polyposis, or FAP. And it's much less common, and it only accounts for about approximately 1% of all annual colon cancer cases, but it's a pretty hard type to actually treat because people with FAP, they develop hundreds of thousands of colon polyps. And as you know, originally these are going to be benign, so these will develop and be non-cancerous. But over time, there's nearly 100% chance that they will develop into cancer if you don't treat them. And so then it becomes much harder. How do you treat an individual that's going to be constantly producing these hundreds of thousands of polyps to ensure that they don't develop cancer down the line? Because once that cancer develops and then spreads beyond the colon, it becomes much harder to treat. And FAP arises because individuals with this syndrome, they have mutations in the APC gene. And this is going to affect the ability of the cell to be able to maintain normal growth and function. So this gene is responsible for making sure that particular signal transduction pathways are in place that regulate normal cell growth. And so when you have mutations now, the cell is no longer able to regulate when it grows and divides, and it's going to function abnormally, and as you know, that's the hallmark for cancer, so this abnormal cell growth. And so I previously said that colorectal cancer is going to be the second leading cause for men and women of cancer-related deaths. And so it's staggering to think that as many as 60% of those deaths could have been prevented if everyone age 50 and older were screened regularly. And this is really important because colon cancer is extremely treatable as long as you catch it early. So before the cancer has grown beyond the colon and spread to other organ systems, you're able to usually remove it or treat it very effectively so that you have very high survival rates and low incidence of reoccurrence. And so as a public health professional, how can you sort of reach out to individuals and encourage them to start this regular screening once they hit that age of 50? Or if they have any of these other risk factors or a family history, perhaps talking to their doctors and maybe starting regular screening either earlier or more frequently. And so how do you screen for colon cancer, and what are the recommendations for the type of screening that should be done? So again, this regular screening should begin at age 50, and this is for anyone who's at low risk. So, doesn't have a significant family history, doesn't have these other risk factors. Okay, and so there's three main tests that they use to screen for colorectal cancer, and we'll talk a little bit more about them in the next slide. And so this is going to include looking for blood in the stool, as well as then using scopes to actually physically go in and look and see, are there polyps present? Should we potentially remove them? Do we see any sort of cancer growth? Okay, and again, cancer screening should be done for all individuals starting at age 50 and continuing to age 75. And again, keeping in mind that those with certain risk factors or any sort of genetic disease, family history, maybe they should be screened earlier and screened more frequently. Okay. So the recommended screening tests and intervals. The first one is going to be something called high sensitivity fecal occult blood test. And this checks for hidden blood or melena in stool samples. And it's non-invasive and it's quite easy to do. So what it is just checking for is there any blood present in the stool, and this would signify that perhaps there is, some sort of abnormal growth in the colon that is causing this to occur. This can be easily done in the doctor's office and should be done every year, because if this were to come back positive, then you could move on to the next screening tests. Okay, so the second one's going to be sigmoidoscopy, and this is just going to be where a smaller lighted tube can go into the rectum and part of the colon and sort of actually go in and look and see, are there any polyps present? Is there any sort of precancerous or cancerous abnormal growth that can be removed or potentially treated? And this should be done every 5 years with the fecal occult blood test. And then the big one that you hear people talking about a lot are going to be the colonoscopies. And this is going to be where you look at the entire length of the large intestine for any sort of polyps or abnormal growth. And this should only really be done every 10 years. Okay, and you can see here, this is what a colonoscopy looks like in this sort of cartoon here. So the colonoscope is going to be inserted through the rectum and then sort of travel all the way through the colon. So it's going to give the doctor the ability to look at the entire length of the large intestine, looking for any sorts of abnormal growth and the presence of any polyps. And potentially during this procedure, usually it has a tool at the end of the scope that can actually remove these polyps. So if you remove these polyps before they form into cancerous cells or become malignant, it's basically treating cancer before it begins, and that person then isn't going to be at much lower risk for developing cancer. Okay, and so the video I'm going to show you next is going to be an actual removal of one of these polyps during a colonoscopy.
The colonoscope is a fiber optic tube that's inserted through the anus and kind of snaked up through the colon, the large intestine, allowing the physician to view the inside of the colon. And if they see a polyp like that, this is how they remove it. You show the video. There's a little snare coming from the end of the colonoscope, kind of catches the polyp, like a little scissors, snips it off, and then takes it out.
So what are the signs and symptoms of colon cancer? And individuals should be aware of these so they know if they're experiencing one or more of them. They should really seek go and see a doctor and discuss with them whether or not you should be screened for colorectal cancer at that time. And so the symptoms or signs include the following. So any change in bowel habits, something that's been going on for more than a few weeks. Any sort of rectal bleeding or blood and stool. Remember, this is one of the things that you're screening for in those regular screenings after the age of 50. Persistent abdominal discomfort, abdominal pain with any bowel movements, or a feeling that your bowel isn't completely emptying, weakness or fatigue, as well as any sort of unexplained weight loss. Because remember, your large intestine is an important site for nutrient absorption, and so if you have a cancerous growth or any sort of obstruction, that's going to be compromised. Okay. The important thing that you can probably see is a lot of these signs or symptoms really overlap with other sorts of medical conditions. And so you really should seek out, professional medical advice because they're going to be better able to determine what's actually going on and making sure that you don't have colon cancer. Okay. And so once an individual comes in and perhaps they're, have signs and symptoms, they're being screened for colon cancer, or maybe they're just being regularly screened after the age of 50, and it's, detected that they actually do have cancerous growth, the next thing once they're diagnosed with it that becomes very important is staging of that cancer. So figuring out how far along has this cancer developed, because the ways in which you treat the cancer is going to depend a lot on what stage it's at, as well as this really tells you what are the sort of overall survival rates that you see in individuals with differently progressed cancer. Okay, so the first stage that you see a lot of times now is they consider something which is sort of carcinoma in situ, or this stage 0, where it's just this initial growth of abnormal cells. So they're still in the mucosa, this innermost layer, and they haven't really formed any sort of cancer or spread. And there's a lot of controversy now with different types of cancer saying, is this sort of stage 0 or carcinoma in situ actually a positive cancer diagnosis? Because in some individuals, this very early abnormal cell growth, it might just stop and it might actually never develop into malignant cancer. And so you'll see this now more where they consider something the sort of stage 0. Okay, but a lot of individuals that have colon cancer are typically going to be more in stage 1. So stage 1 colon cancer is where cancer has formed in the mucosa, that innermost layer, and has then spread to the submucosa, or the layer beyond the mucosa. And so it also might have started to spread into the muscles surrounding the colon. Okay. In stage 2, this cancer has grown much further, and what you see now is that to get a more detailed idea of how far the cancer has progressed, stage 2 is divided actually into 3 different stages. So in stage 2A, the cancer has spread through the muscle and just to the outer colon wall, so it hasn't spread beyond that. In stage 2B, the cancer has spread through the entire colon, so then through the muscle layers in the serosa, so it's spread all the way through the colon wall, but it has not gone to nearby organs. In stage 2C, it's grown all the way through the serosa, so all the way through the colon wall, and now you actually are seeing cancerous cells present in just nearby organs, so things that are going to be adjacent to the colon. Okay. Stage 3 colon cancer is again going to be divided into stage 3A and stage 3B. So in stage 3A, you have cancer that's spread through at least a portion of the colon, but also it's spread beyond it and it's present in nearby lymph nodes or nearby tissues. So you can see here, compared to the later stages or the later stage 2 cancers, this cancer actually hasn't grown all the way through the colon wall, but still it started to spread, and when you look at nearby lymph nodes or tissues, you're seeing the presence of these cancerous cells. Okay. In stage 3B, what you're seeing is that, it could be a combination of different things, where it might have grown all the way through the colon wall, and as well as being present in nearby tissues or lymph nodes, or it could be just in, a certain increased number of lymph nodes. Perhaps it hasn't grown all the way through the colon wall, but you're seeing it in 7 or more lymph nodes at this point. And again, this is all, something that's going to be indicative of how far this cancer has spread and how easy it is going to be treated. So sort of how far along has this progressed. Okay. There's also stage 3C, where you have the cancer has grown all the way through the colon wall. So here you have it grown all the way through, and it also has spread to nearby organs. So it's in the lymph nodes and it's in nearby organs. So now you can see that it's going to be much harder to treat because it's grown all the way through the colon wall, and these cancerous cells have metastasized. And, potentially this can lead to the development of stage 4 colon cancer. And any sort of stage 4 cancer disease, this is really when the cancer has spread from that original site and it's really traveled all throughout the body. So it's gotten into the blood, it's gotten into the lymph, and you're going to see tumors forming in very distant parts of the body. So you might see that colon cancer travel and metastasize to the lungs or the brain or the liver. Okay, and so this becomes much, much harder to treat because now you can't just really go in and remove that cancer. That cancer is really metastasized everywhere, and it's going to start to cause complications with all of these different organ systems. Okay, and you can really see this illustrated here. So these are going to be the 5-year relative survival rates for colon cancer based on stage. Okay, so stage 1 colon cancer, where it hasn't really grown past that first, those 2 innermost layers of the mucosa, you have about a 92% survival rate, 5-year survival rate. And this is quite high because going in and removing that cancerous growth before it, grows beyond the colon makes it very easy to treat. And so, again, this goes back to making sure that people get screened once they hit that age of highest risk. So once they enter into their 50s, making sure they're screened, because catching it early, it's very easy to treat. Once it's really spread, now you have, stage 4 colon cancer. It's, really cancer that's going to affect all these different organ systems. Your 5-year cancer survival rates go down to be much lower, so only about 11%. Okay, and so what are your treatment options for treating colorectal cancer once it's been diagnosed? And so the most common treatment for colon cancer is going to be surgery. And so basically removing all cancerous cell growth. And so if you catch it early and that cancerous cell growth is contained to the colon, surgery is going to be much more successful. So going in and either resecting a portion of the colon or just being able to kind of cut out that polyp, that's going to successfully treat most forms of colorectal cancer. Once the cancer has spread beyond the colon, chemotherapy can also be very, very effective and sort of reducing the chance of reoccurrence, as well as treating those, more distant tumors now. So those cells that have gone beyond the colon, they might be harder to remove surgically. And so you'll recall that chemotherapy is using drugs that are going to specifically target proliferating cells. So you have the chance then of making sure that you're getting rid of all cancerous cell growth through chemotherapy. Radiotherapy or radiation is not a typical treatment for colon cancer, although you might see it being used as an option for when an individual has much more progressed colon cancer. So stage 3 or stage 4, radiation therapy might be recommended because it can be a little bit more targeted to a certain area where the cancerous cell growth is observed. Follow-up testing is going to be very important. So after colon cancer has been initially diagnosed and then treated, you want to ensure that you don't see it coming back in the years that follow. Typically, when you have cancer reoccurring, it could be because those cancer cells had, gotten out from the original site and metastasized to other areas in the body. And so follow-up testing can potentially identify that, and then you would want to be, again, treated for recurrent colon cancer. As well as you might have cancerous growth sort of come back at the original site because all of it wasn't removed in that initial surgery or initial treatment.